There's a new urgency in the fight to find the cause of autism. A stunning new report shows a dramatic rise in the number of children in the U.S. diagnosed with the condition. The Centers for Disease Control now estimates that 1 in 68 children have been identified with an autism spectrum disorder. That's a 30% jump from a previous study done just in 2008 and represents a steady rise in the cases over the last decade. Researchers also found that boys are 5 times more likely than girls to have autism. The CDC based the report on a review of records for 8-year-olds in 11 states in 2010. The term autism spectrum can encompass a broad range of developmental brain disorders that can range from mild social awkwardness to an inability to communicate. And what's perhaps the most troubling part of this study is that there's no definitive answer on what's behind the increase and still no answer to what causes autism. Joining me now, Dr. Max Wiznitzer, a pediatric neurologist at Rainbow Babies and Children's Hospital in Cleveland, and Liz Feld, president of the autism group Autism Speaks. Thank you both for joining. Doctor, let me start with you here because I understand you have issues with this. What is the first thing that stands out to you? Obviously, for, I think, the average person that is not a doctor, when you hear 1 in 68 and that increase over such a short period of time, you say, how's that possible?
Well, the thing that stands for me is I believe the numbers, but I ask myself exactly what group we're describing. Autism is different now than it was 20 years ago. 70% of them have normal intelligence, while at 20 years ago, maybe 30–40% did. The kids, as you stated, are milder in nature. We've broadened the criteria for inclusion in terms of how to diagnose them, and also there's a greater awareness of the condition. In this study specifically, the people who did the study did not lay hands on the children and say, yes, we can confirm that this is the diagnosis. They reviewed records. They reviewed school records. They reviewed medical records, which means that their conclusions are only based on the information they have in front of them. And if people don't give a description that is not actually accurate with what the child has, you may come up with an erroneous diagnosis.
Which is in itself absolutely disturbing that, you know, you hear these reports, you send parents, I think, doctor, into a nervous wreck, whether they have a child who's under the age of 4 or perhaps even considering having a child, especially when it's followed by, we don't know what causes it. So what is the responsible way, doctor, to process, in your opinion, this information?
The responsible way is to understand that while this number is there, the chances are overwhelming. Even if it's 1.47%, that means you've got a 98.5% chance of a child not having it. I mean, those are better odds than you get at Vegas, if you think about it. Much, much better than that. And it's much better in lots of other conditions. Number two, even when people identify if kids having social differences, before you say they must have autism, which is what everyone jumps to nowadays, you need further investigation. You have to ask, is this just within the range of normal? Are there other reasons that can cause it? Which most of the time you find other reasons that cause it. So you should not conclude because my child perhaps didn't speak exactly when wanted that we're in trouble.
Liz, let me go to you because the work that you and your organization have done is tremendous, invaluable there. But I also understand that this report, some believe that because we are more knowledgeable, that children who perhaps would have slipped through the cracks before are now being counted as we attempt to understand. What's your reaction to this new report?
Well, first of all, it's very important for everyone to understand and recognize that behind every one of these statistics is a person living with autism. Yes. This morning in this country, 3 million people from age 2 all the way up till 80 woke up with autism, and they have needs across their lifespan, from needing behavioral therapies to help after school to employment opportunities, housing, supports, a whole host of issues, a whole host of services. So I'll tell you, you cannot explain away a doubling of prevalence in the last 10 years by better detection. And while we certainly have that, and thanks to organizations like Autism Speaks and others, there is more awareness. There are so many unanswered questions here right now, which is why autism needs to be a national public health priority. We need a national strategy that includes all the stakeholders, the medical community, researchers, educators, policymakers, people living with autism right now, to come together to work on the challenges that this community faces.
Absolutely. And just in New York, where you have, well, just in New York, you had a boy who disappeared from school, later found dead, Avante Akendo, whose mother is still battling for people to understand that what's known as wandering, when children with autism have a tendency to leave, and keeping an eye and educating teachers in schools about how to handle these children.
There have been 42 wandering deaths since 2011. You know, 1/3 of our population is nonverbal.
Yeah.
1/3 seizure disorders. There are GI issues associated with autism. As I said, a range of medical conditions that are associated with autism. And the fact that we now have bipartisan support in Washington for a national strategy to address this tells you that these numbers speak loud and clear to the urgent need for more research funding and more attention.
Liz, thank you. Doctor, thank you as well. And Liz, I have my pin, and I will be wearing it as well. Thank you so much.
Thank you for all the exposure you've given to this issue.
Of course. And Doctor, thank you for your time. Thank you,
Thank you.
Okay, a USA Today sports writer says if NFL players are drug tested, then the team's owners should be too. What do you think of that? We're going to talk with a writer who just got back from